Hi, my name is Ryan, and this is my Module 8.2, Self-Reflection, Outcomes Achievement using the NCLEX Clinical Judgment Measurement Model when caring for a patient with a chronic illness. I chose this from my experience working in home care and often focused on health promotion with patients with chronic illnesses. For this example, I will focus on somebody with a history of chronic heart failure with new onset of weight gain, edema, and shortness of breath. When caring for a patient with a chronic illness like CHF, requires the nurse to assess changes in their overall health, recognize signs of disease progression, and make evidence-based nursing judgment to provide safe, quality care that is in line with their goals. The first step of the clinical judgment model is recognize cues. I would perform a comprehensive assessment. This would include evaluating vital signs, oxygen saturation, lung sounds, heart sounds, weight, edema, and activity tolerance. I would also review the patient's medical history, complete a full medication reconciliation, review any laboratory results, and ask about any recent changes or new developing symptoms. The next step is analyze cues. I would interpret these findings to determine if the patient's symptoms are related to an exacerbation of their heart failure. I would also consider contributing factors such as medication adherence, diet, or any recent illnesses. Next, I would prioritize hypotheses. My highest priority would be impaired oxygenation. Following the prioritization of airway breathing circulation, decreased cardiac output poses the highest immediate risk to the patient's safety. Generate solutions would be my next step by planning evidence-based interventions. These would include administering oxygen for impaired oxygenation, anticipating prescribed medications such as diuretics, monitoring fluid balance, and providing education about medication adherence, low sodium diet, and recognizing early signs of worsening heart failure. Other interventions could be positioning the patient in high Fowler's position to help with shortness of breath, and possible therapy referrals when the patient is more stable to help recover their strength and stamina. The fifth step is take action. By implementing these interventions, collaborating with the healthcare team, and continuing reassessing the patient's condition. The final step would be evaluate outcomes. I would determine whether the patient's breathing, oxygen saturation, and edema have improved. This could be achieved by evaluating their decreased symptoms, improving weights and vital signs, and resolving edema. I would also evaluate that the patient demonstrates an understanding of how to safely manage their chronic illness after discharge. By applying the clinical judgment measurement model throughout the nursing process, I can make informed nursing judgments supported by evidence to provide safe, high quality, patient centered care for individuals living with chronic illnesses across their lifespan.